Malin, I want to turn to you and hear about belantamab mafodotin. There was a lot of data, in combination data with lower dosing, different schedules being presented in the relapse space, the GSI combinations, the work that you've kind of, done at MSK. And I mean, Bella is even in the frontline setting. We saw the Lendex combo data, or the earlier, setting data from the Greek myeloma group. And then, I had the privilege of presenting the early look in the DREAMM-9 study with belamaf along with RVD for transplant ineligible patients. So a lot of Bella data, but, what's your summary?
My summary is that I think this is a good drug, and since there's a lot of trials going on, it's a good drug, but it has the toxicity with the keratopathy and the ocular toxicity. There are a lot of efforts trying to kind of mitigate these side effects and doing smart combination and with lower doses to try to maximize the effect and minimize the side effects. So I think that's kind of what the main takeaway from all of this. And I think combining with GSI is something that we're going to start up a trial early next year as well. So that's a gamma secretase inhibitor that inhibits the gamma secretase, which sheds BCMA from the cell surface. So I think this is a very interesting combination, and it hopefully will show very good effects at lower doses, and there's also fewer side effects. So I think this is a drug that's going to be around, but it needs to work a little bit more on where exactly to have it and what the best combination is and the best kind of dosing to avoid the ocular toxicity.
No, I agree. I think, even in the DREAMM-9 study, the idea of combining belantamab mafodotin is in lower doses, in less frequent schedule for older patients. Apparently, I mean, the data that was shared, shows that it's doable. It's just that we need a longer follow-up for those patients. Once you get to that optimal response in a multi-mechanism of action approach, you can pare down therapy, so this can be similar to, a quad being utilized for X number of cycles, you get to a certain response, and then you go to maintenance.